You heard it, I heard it, everybody heard it. Hydroxychloroquine, chloroquine, can they be used to treat coronavirus? That's the big question that we're answering today. I'm Dr. Jen Caudle. Thank you guys so much for joining me. I'm doing daily videos on coronavirus. I'm going to jump right in, okay? At the risk of you shutting off this video, which I hope you don't, but at the risk of that, I'm going to tell you right off the bat, can hydroxychloroquine or chloroquine treat coronavirus or prevent it? The answer is we don't know. We don't. Okay, the drugs have not been studied appropriately, adequately enough to be able to know if they actually treat coronavirus. These drugs are being looked at as possible treatments for coronavirus, but before they're approved for treatments, they have to undergo testing, which is a good thing, guys. Remember, right now, as of today's date, March 20th, there is no FDA-approved treatment for coronavirus. Let me go back, though, and tell you a little bit about what hydroxychloroquine and chloroquine are, because I know many of you are actually familiar with these medications. If you're not, you might be saying, gosh, I think I've heard of these, but what do they do? So chloroquine actually is a medication that treats malaria, okay? So these medications are prescribed for malarial treatment. Again, this is not approved for coronavirus treatment at this time. Hydroxychloroquine is a metabolite of chloroquine. That means it's like a cousin, a relative of chloroquine. It's used to treat malaria, but it's also used for treatment for other conditions that you might very well be familiar with. That is things like lupus, rheumatoid arthritis, juvenile rheumatoid arthritis, etc. I have many patients that are actually on hydroxychloroquine. So these medications have been around. There are also other medications that we are looking at to see if they help treat coronavirus. Guys, that is the good news to take from this. While I can't tell you that chloroquine or hydroxychloroquine will actually treat coronavirus at this point because we don't have the data, what I can tell you is that it's a good thing that we're looking at different medications. Remdesivir is a medication that's been on the market for other things that we are looking at to see if it helps. Chloroquine and hydroxychloroquine, hopefully we'll get more studies, and hopefully we'll be looking at other medications. Just a quick note about vaccines as well, guys, just so you're up to date about that. We are currently looking for a vaccine for coronavirus, as you probably well know. We are fast tracking that, which is a good thing, but fast tracking still means we're probably about a year to a year and a half off from really knowing where we stand with that. So guys, keep your eye on this, okay? It's important to be hopeful, but let's not take it out of context. Hydroxychloroquine and chloroquine may very well be options for coronavirus, or they may not be. We just don't quite know yet. Let's be hopeful at the fact that we are looking at different medications to see what may be used to treat coronavirus, but let's also not get ahead of ourselves and do things that may be potentially dangerous. That's the danger in assuming things work before we know that they work, is we could potentially be putting ourselves in harm's way. Medications, all medications have some potential side effect. So don't take it lightly and don't just assume, oh, they've been on the market, they're fine, I'm going to take this anyway. Nope. Remember, before you do anything about anything, you call your doctor. But remember, we don't have enough evidence as of today to say if these two medications will treat coronavirus. Stay tuned for more updates. I will come at you as much and as fast as I can with coronavirus information. I'm Dr. Jen Caudle. Stay safe, guys.